Good day everyone, I am Rachel Outlatero. For today's video, I am going to discuss or we are going to tackle the contraceptive methods, their effectiveness, benefits, and their impacts on adolescent health. Before I discuss the contraceptive methods, first is we are going to define what is contraceptive. Contraceptive, birth control, also known as contraception, is any method, use of medicines, devices, or surgery to prevent pregnancy. Some are reversible, while ang uban is permanent lang. Now, I am going to discuss the contraceptive methods. The first contraceptive methods I am going to discuss is male condom. A male condom is a thin, shell-like covering made of latex, polyurethane, or other materials. It covers all over the penis during sexual activity to prevent pregnancy and sexually transmitted or STIs. So ang condom, nag-act siya as a barrier preventing sperm from entering the vagina or anus. Effectiveness ani niya is 80 to 85% or up to 98% when used it correctly. Second contraceptive methods is implantable hormone device. An implantable hormone device, often called a birth control implant, is a small plastic rod that releases hormones to prevent pregnancy. Gina-insert ni siya ilalim sa panit, which is sa upper arm dapit. So kini nga implant device slowly releases hormones into the body over a period of time, usually mga 3 to 5 years. These hormones go-work ni siya by preventing ovulation, the release of an egg from the ovary, and thickening cervical mucus nga maglisod si sperm to reach the egg. So kanina device is long-lasting, considered ni siya to be more than 99% effective at preventing pregnancy. Third is the calendar method. The calendar method, also known as the rhythm method, is a natural birth control method that involves tracking menstrual cycles to predict ovulation. Nag-work ni siya by tracking your cycle. You need to keep a record sa imong menstrual cycles for at least 6 months para ma-determine ang length sa imong shortest o longest cycles. The calendar method is considered a less effective form of birth control compared to other methods like hormonal contraceptives or barrier methods. It requires careful record keeping and a commitment to abstinence or barrier methods during your fertile window. Fourth is the birth control pill. By preventing ovulation, the hormones in the pill prevent your ovaries from releasing an egg. Ang pills also thickens the mucus in your cervix, making it difficult para sa sperm to travel through nga ma-reach ang egg. Fifth is the birth control injection. Birth control injection contains progestin injected into the arm or buttocks every 3 months to prevent pregnancy. It also thickens cervical mucus to make it difficult for sperm to fertilize an egg. 6. Withdrawal. Withdrawal, also known as the pull-out method or coitus interruptus, is a form of birth control where the male partner removes his penis from the vagina before ejaculating. The goal is to prevent sperm from entering the vagina and reaching the egg. How it works. Timing is crucial. The male partner must be able to accurately predict when ejaculation is imminent and withdraw before any semen is released. Effectiveness. Not very reliable. Withdrawal is considered one of the least effective methods of birth control. Studies show that about 4% of couples who use it correctly will become pregnant each year. The last one is the intrauterine device. An intrauterine device, or IUD, is a small T-shaped device made of plastic and sometimes copper or hormones. It's inserted into the uterus by a healthcare provider to prevent pregnancy. The IUD is inserted through the vagina and into the uterus where it remains in place for several years. IUDs work by preventing sperm from fertilizing an egg. IUDs are effective and long-lasting forms of reversible contraception. It can provide protection for 3 to 10 years depending on the type. With the samples of contraception methods, I will discuss also the effects of early pregnancy in the growing adolescent. Na ay mga serious health risks associated with early pregnancy because ang lawas sa young mga babae is dili pa mature enough or di pa kaya mag-handle sa child. A woman under 20 has a developing pelvic area potentially too small for easy childbirth. So when a woman is under 20 pa, ang pelvic area, the bone surrounding the birth canal, is still growing and may not be large enough to allow the baby to easily pass the birth canal, which can result dayon nga ginatawag og obstructed labor. Obstructed labor. Labor that does not advance due to the baby's size exceeding the birth canal's capacity. Ang obstructed labor is dangerous siya both sa mother ug sa child, and it requires the help sa trained medical professionals. Under the best circumstances, naay operation dayon nga pagahimoon nga ginatawag og cesarean. In addition, younger women who become pregnant face a higher risk than older women in developing a number of other complications. These complications can be any or a combination of the following manifestations. So these are the complications of early pregnancy. Excessive vomiting. It can lead to dehydration and nutritional deficiencies. Severe anemia. Lack of iron in the blood affecting oxygen transport to the baby. Hypertension. High blood pressure potentially dangerous for both mother and the baby. Convulsions. Seizures caused by preeclampsia, a serious pregnancy condition. Difficulty in breastfeeding. Young mothers may lack sufficient milk production. Premature and low birth weight babies. Infants born before 37 weeks or weighing less than 5.5 pounds. Infection. Increased risk due to hormonal changes and weakened immune system. Prolonged labor can lead to fatigue and exhaustion for the mother. High maternal mortality death. Increased risk of death during pregnancy or childbirth. Contraceptive methods can help prevent unplanned pregnancies and related risks. Understanding the options and choosing the right method is crucial. In conclusion, using contraception allows individuals to control their reproductive health and make informed decisions about family planning. So this is the end of my discussion for today. Thank you for watching.